ask you some questions in this case respecting your opinions and the opinions you have formed and the bases for them. And I'm going to ask you to provide me with, in a reasonable degree of medical probability or certainty. Can you do that?
Yes.
Okay. On what were you requested to analyze and opine in this case?
So it's fourfold. One, I was asked to opine about the risk factors that are associated with intimate partner violence and behaviors that are shown, risk factors that are shown in intimate partner violence to be consistent with behaviors that Mr. Depp has demonstrated. Two, I've been asked to opine about the acute effects on alcohol and substance use, and I mentioned that including mood, behavior, cognition, functional impairment. Three, talking about the psychological profile, if you would, of, is there a question? I'm sorry. Oh,
no.
Okay. Of psychological and medical sequelae of patients who have suffered intimate partner violence and perpetrated intimate partner violence, and whether or not Mr. Depp's behavior is consistent with that. And lastly, about alcohol and other substance use disorders, their diagnostic criteria, their medical and psychological effects, psychiatric effects, their cognitive effects, and their functional effects. And I think I would like to just go with the jury one other thing. When we talk about, when psychiatry talks about substance use disorders, it's imperative to understand we're not talking about someone who rarely uses and happens to have a bad night. We're not talking about someone who uses on a weekly basis and has a bad night. We're talking about repetitive patterns of behavior that meet a list of 11 criteria that can be deemed mild, moderate, or severe. Because I think people get confused when they hear the word substance abuse, that they think of, oh, I may have used this because I used it twice.